Perfect. It's 9 o'clock and we're going to start the recording and everything now.
Did you know that more than 10 million people are struggling with Parkinson's disease globally? This number is expected to double by 2040. Hundreds of thousands of people with Parkinson's disease are living in poverty, undiagnosed, untreated, without essential medications. The World Parkinson's Program is the only organization that provides free medications to Parkinson's patients at home and around the world. We have a vision for a future where Parkinson's treatment and supportive care is available to all. That is why we're working towards providing free medications to ensure all Parkinson's patients have access to treatment, providing multilingual educational materials globally, providing patients with assistive devices to help prevent serious injuries from falls. But none of this is possible without you. By donating today, you can help us sponsor medications for at least one Parkinson's patient living in poverty. Provide patients with the information needed to better manage their symptoms. Prevent a Parkinson's disease-related injury. You can help transform the lives of so many, starting today. Visit us at www.pdprogram.org to learn more.
I want to thank everybody for coming today. We're so pleased to have an online patient summit, and we do have the opportunity to continue sharing information with you and letting everyone know the good works that WPP is doing and the various activities that take place both here in Canada and around the world. Our guest speaker today is Dr. Rana. He is the founder of WPP. He is a world-renowned Canadian neurologist, and he specializes in Parkinson's disease and movement disorders. After his neurology residence training, he completed his fellowship in Parkinson's disease and movement disorders from the University of Ottawa. Dr. Rana is currently the director of Parkinson's Clinic of Eastern Toronto and Movement Disorder Center in Toronto. And Dr. Rana is the founder and former editor-in-chief of the Journal of Research and Reviews on Parkinsonism, published by Dove Press. He has published extensively in the field of neurology, Parkinson's disease, and movement disorders. Dr. Rana has been an invited speaker and has conducted seminars on Parkinson's disease at international level, and he has been an award winner on many of his research papers and projects. Over the years, Dr. Rana has published over 500 research papers and has 30 published books on Parkinson's and movement disorder. We are very honored to have him here today to share his knowledge and information for all of us here today. Just a little bit of quick housekeeping before I hand it over. We do have a chat window available. If that's available to you, go ahead and write in any questions there. Someone is monitoring, and we will go to a Q&A at the end. Once we go to Q&A, if you also know how to raise your hand in Zoom, we will also be monitoring that so we can go into more of a Q&A personally at the end. And otherwise, we will hold all of our other comments and keep everyone on mute as we pass over to Dr. Rana. Thank you so much for being here. It's lovely to see you.
Hello, everyone. Can you guys hear me?
Yes, we can hear you. Yeah.
Good. So, when it comes to Parkinson's, I usually talk to my patients every day when I see them in clinic. So after I assess them, then we have chat about, Parkinson's and a little bit about history and future and stuff like this. So three things I usually focus about Parkinson's is number one, treatment. Of course, medications. You have to take it on time, regularly, as we make a plan with the patient, caregiver, myself. The second thing, I focus on exercise. And the third thing, I focus on knowledge about Parkinson's. So knowledge about Parkinson's is as important as exercise, and as treatment. And actually knowledge and exercise are part of treatment of Parkinson's. So that's what we're doing, discussing Parkinson's today from a very simple and very high view, just for people to, refresh. I'm sure you have been going on Google and online and so many, information. A lot of information on online resources is not the best source because people keep on putting their own personal experiences and stuff like this. So it's always good to be linked with an organization like WPP so that you have the credible source of information. So Parkinson's is nothing like new, although the modern description was by James Parkinson in London, England in 1817. He was a GP. He wrote an essay on shaking palsy in which he discussed several patients. But the history goes really back, 5000 BC. They used to treat it with the legumes, and these are the same legumes which have dopamine, right? So Parkinson's has been affecting humanity for thousands of years. Parkinson's always starts slowly. It's not that you sleep, you one day wake up, next day you're paralyzed or something. No, it always affects one side of the body. People notice either they become slow on that side or they get a small tremor in the hand or fingers, and slowly then it progresses. It affects all sorts of people, although the common age of onset is about 55, 60, but about 10% of people they have symptom of Parkinson's before the age of 50, and 5% of the have before the age of 40. So it does not just affect elderly. It's not the disease of only elderly people, so anyone could be affected. So, patients usually ask, what is the cause of Parkinson's? Why do I have Parkinson's? So usually about, 10, 15% of the cases are genetic. And as we're learning more, our knowledge about the genetics of Parkinson is increasing. Usually there is a family member, like a, distant family member or a cousin or someone before who had Parkinson's. And in some cases, there is, people don't recall anyone affected with Parkinson's. So we really don't know the exact cause of Parkinson's, what happens, but there has been some associations with the pesticides, drinking well water, and exposure to certain toxins, and certain medications can cause Parkinson's-like symptoms. In US, about 60,000 people are diagnosed every year. And in Canada, about 6,000 to 7,000 patients are diagnosed every year in Parkinson's. The number of Parkinson's patients is increasing. In Australia, they say about 30 to 40 patients are diagnosed every single day. We don't have information about the countries in Africa or Asia because lack of infrastructure or some, statistics, but they say the number will be double by 2040. The most common symptom of Parkinson's, most people say it's a tremor. So indeed, the tremor is only present in about 70% of the patients, and about 30%, 1/3 of the patients don't have a tremor. So slowness is the key symptom of Parkinson's, and that is one of the reasons that the diagnosis could be delayed, because people think that, oh, I'm 60 or 65. If I'm getting a little bit slow, it could be age, and sometimes people might think, oh, it's arthritis, or it's just, I'm getting tired, or stuff like this. But the slowness, which is tested by physicians by various movements of body, is the main symptom of Parkinson's. The tremor starts on one side of the body. It affects usually hand or fingers, and sometimes just the thumb and index finger. And that is the reason it used to be called like a pill rolling tremor, because the hand and fingers move side to side. Most patients are not familiar with stiffness or rigidity, but when the physician tests the patients, then they notice the stiffness of muscles in the arms, or in the neck, and it's more usually on one side of the body. As the disease progresses, then patients start feeling unsteady on their feet. They may fall, and the balance problems become worse and worse. So usually patients would report, or the family members would report, that they start taking longer time to complete their activities, and also the, like writing changes, small, it becomes small size handwriting. Their fine motor movements, fastening buttons, or putting socks, and using screwdriver, or any kind of fine, motor activities become a challenge. And usually this progresses with time. It starts on one side and goes to the other side. As I was mentioning, the tremor is seen in about 2/3 to 70% of the patients, and 30% may not have tremor. The tremor of Parkinson's usually does not involve head or voice as compared to some other types of tremor. It could involve legs. In some cases, patients are sitting relaxed and their foot starts shaking, sometimes chin and lip. And most common site of tremor of Parkinson's is the arms, hands or arms. The tremor of Parkinson is classically called a resting tremor. When the patient is sitting relaxed, they're not using their hands. At that time, it starts shaking, and when they start using the hand, usually it dampens. As the disease progresses, people feel unsteady. Balance problems become an issue. The posture changes. Patients may look like they're leaning to the side, which is affected with Parkinson's, and also their posture becomes somewhat stooped, like bent over, and this creates a problem while they're walking, and this is how the balance gets affected and patients could fall. The classical symptoms of slowness, which is also called bradykinesia, tremor, stiffness, and balance problems, these are the main motor symptoms. We call them motor symptoms because they affect movements of body. So these are the common symptoms. Most people are familiar with them. You will read in media, or whenever you open any online source. But there are many other symptoms which we call non-motor symptoms, because they may not affect movement, but they cause significant decline in the quality of life. And in some cases, these non-motor symptoms may start much before the motor symptoms, and they can lead to complications, and patients have difficulty coping with them, even the caregiver. So then a time comes when family cannot handle it anymore, and patients may have to be transferred to long-term care. There are many non-motor symptoms. As we learn every day, the list is increasing. The family notices sometimes the loss of facial expressions of the patients. Their face does not show the expressions. When we, for example, when you suppose you get a letter that you win a lottery, your face would show, when you're reading that letter. Or if you get a letter from CRA, then the person can tell that you're reading something serious. But in Parkinson's, you lose that facial expression. So face, sometimes they call it mask-like face, right? And a lot of patients have loss of sense of smell, which can start many years before. And some patients will say that I never had a good sense of smell. So in most patients, it starts many more years before other symptoms of Parkinson's. And sometimes they go to bank, and their own signature, they can be recognized because their handwriting has become small. So some patients may start writing normally, but when they reach to the end of sentence, the words are very small. The letters are very small. Many patients notice some lack of interest in doing things which they used to enjoy, although they may not have a very frank or major depression, but we call it dysthymia. Dysthymia is like a lack of interest, feeling sadness, and sometimes it could, progress slowly, and patients need to be assessed for depression. Some patients start feeling symptoms of anxiety. They become anxious over very small things, and sometimes they could get panic attacks. So anxiety and depression, they could start before the other symptoms of Parkinson's and may go unnoticed sometime. So as as we discussed, that Parkinson's is increasing. It's affecting not only elderly people but young people. These patients, in the beginning, the symptoms may be mild, but as the disease progresses, they start needing more and more, not only emotional support, but physical support. So this was the idea, that how we can help patients with Parkinson's at every level: education, exercise, and the most important things is the treatment, medications, right? So so we started in 2008. September 1st was my 40th birthday when I started. I was doing this work for some time. In 2004-5, I started, and I was thinking that what is the major and most important need of Parkinson's patients globally, because I travel overseas to see patients. So I used to see patients who could not afford medications. They had no access to exercise programs. There was no credible literature. So on that 40th birthday, I decided that, okay, I was doing this homework, and then we formally started WPP, World Parkinson's Program. And then we started adding the components. We started with the lectures and seminars and education literature, and slowly we started expanding. Then a time came when the board became quite extensive, and our current board is highly dedicated and committed. These are professional people, and they are all no one is they are all volunteers, right? And they have changed the lives of thousands of people. So what we do at WPP is we provide medications to patients. There is no other organization. There are many other organizations which are doing good work, like research and seminars, but WPP is quite different. Because the most important basic need of every single patient is medication. If you don't give medication, you can learn about Parkinson's, you can exercise, nothing is going to make a significant difference than medication. So that is the core mandate of WPP. That's what we do. I think Nadeem will talk about it more. Sorry, I forgot. I just, when I start talking, I don't stop, Someone
No
has to
problem.
interrupt.
No problem. Thank you so much, Dr. Rana. Thanks for your time this morning. Good morning, everyone. I really appreciate you took your time out in the morning and joined us. So as Dr. Rana has said, that WPP, the objective of WPP is to provide medication, because medication is the key component of Parkinson's for a Parkinson's patient, which basically drives Parkinson patients for all daily chores. So once they have the medicine, they can move around, they can go to the bathroom, they can go to the shower, they can move outside, or they can walk outside. So Parkinson's disease has been globally increasing, so does the patients. And our target is to provide medicine for every single patient of Parkinson's around the world. Right now in WPP Unique Medicine Program, we have over 500 patients registered who gets their daily medicine from WPP. And we are, as the slide shows, we are in 17 countries and 23 cities around the world. And I would move to the next slide where Dr. Rana will talk about some treatment option. So this is just a high-level global view of our clinics around the world. Dr. Rana, over to you for medication options.
Sure. So as I was saying, the treatment is the main objective of helping patients. Nothing works without medications. That's the first thing. No, right. And, sometimes it happens. I have had few patients, unfortunately, there is so much goes on online media, these days, social media and Twitter and Facebook and Google. I have had few patients who stopped taking medications after a very famous person said online that the treatment cure for Parkinson is very close. So patients said, well, there'll be a cure, something will be coming on in, very soon. So I don't have to take these, 15 pills a day. So unfortunately, the medications are a lifelong strategy for treatment. Patients usually start with 3 times a day, or it depends which medication they're taking, and slowly the dose of medications, the frequency may increase. So there are many different medications. Levodopa is one of the strongest medication for Parkinson's, and most patients need it sometime down in the course of disease. There are many other medications such as dopamine agonist and monoamine B oxidase inhibitors. It is the job of the physician who specializes, neurologist who specializes in Parkinson's, to look at the age of the patient, the stage of the disease, and other comorbidities, and what other symptoms, and then decide what is the most suitable medications. Unfortunately, there is a knee-jerk reaction in some physicians, especially GPs or general neurologists. They put every patient on levodopa. I usually discourage them. I say that you have to take the whole whole picture into the context before you decide. And the other things like exercise, physiotherapy, speech therapy, and in some cases when symptoms become refractory and challenging, some patients may benefit from surgery.
So in addition to that, treatment options, Dr. Rana has published an exercise diary. This exercise diary provides 7 days a week, excellent curriculum. If one can follow that curriculum at their home, it can provide day-to-day exercises and provide some special movement for muscle stretching that can help them to move around during the day. Next slide is about exercise. As Dr. Rana has mentioned, the importance of exercise. What we have been focusing on our weekly program on Saturday. So if you do not know, please make a note, and it's the information is on our website that we have a Saturday weekly program for exercise. We have at 10:30 a.m. every Saturday. It's a live program, so we invite various instructors who provide their experience. These are certified instructors who and they provide exercise programs on a weekly basis. Aside from that, we also sometimes arrange on-site programs. So stay tuned on our website. We try to do at least an on-site program on a quarterly basis, or if it is not possible, at least every second month. And those programs, again, they are focused on exercise in a gym environment. So people can be invited in the gym and they can come out and get benefited out of it. And all these programs are free of cost. The next one is about assistive devices. So this is also a third pillar of Parkinson's, WPP. In this third pillar of WPP, we provide assistive devices. We provide patient care. We provide caregivers seminars, and we also sometimes we invite other organizations like diabetes organizations and Alzheimer organizations who can provide some information, because in some cases, people just not only have Parkinson's, they also dealing with diabetes situations, or they are dealing with Alzheimer. So in those cases, we invite guest speakers, and those guest speakers provide very valuable material for our patients and audience, as well as the caregivers, because it's also important not only with the patient, the education of caregivers is also very important. So we also provide specific sessions for the caregivers. Now, before we move on to the Q&A, I would also like to ask you guys like how you can make a difference. And this is what is very important. You can become a volunteer with us. You can get involved with us on our website. You can share your story. We also have a section on our website where you can share your story that encourages other people who are going through with this difficult time and dealing with Parkinson's. So please do visit our website, pedprogram.org. If you like to become a volunteer, if you like to share your story, get involved. We encourage everyone. We also have a sponsorship program. As I mentioned, we have about 500 patients registered in the program who gets benefit with the free medicine. And this program is not only just US and Canada. We are providing medicine in African countries, and there are about over 10 African countries, some South Asian countries, Middle Eastern countries. So those countries, we have about 500 plus patients. So we will encourage all of you to visit our website. And if you like to become a monthly donor, for one patient is $40 per month, for two patients $80 per month. Let's move on to the Q&A question. So Kelly, over to you for the Q&A. Please go ahead.
So I did get a couple of patient questions. So Dr. Rana, I'm just going to ask you on behalf of one of our guests. And this is from a caregiver's point of view. So is it true that the medications become less effective and need to be changed up? And how do we know when?
As disease progresses, the symptoms become more severe, and medications need to be modified. Sometimes the doses increase, frequencies increase, the effect of medication starts lasting less and less. But the medications are always effective, and patients always need medication. There's no stage in Parkinson's where you can stop your medications. You may need more than one medication, and sometimes it all depends how the treatment from the beginning is going on. If you start with milder medications, my experience is that patients can manage their symptoms for longer periods.
Okay, and Gloria has popped in here. She wants to confirm that medications are only necessary once function is affected.
We used to think this way, that if patient is diagnosed with Parkinson's, but their daily activities are not affected, you don't have to treat them. But this notion has changed now. Most of the experts agree, and research has shown that patients who are treated from the scratch, from the beginning, when they're diagnosed, in the long run, they do better than those who don't take medications in the beginning. So the treatment should be started when you're diagnosed with Parkinson's.
Fiona has a question. Fiona is one of our partner in exercise programs. Fiona, please go ahead.
I just wanted to ask, I have a couple clients who have had quite a number of different difficulties, either falling asleep, staying asleep, or that disturbed sleep in between. Do you have any suggestions at all? Obviously, medication is one of those things, and they have been in contact with the neurologist. The unfortunate part is that they're, the time frame between when they can see their neurologist is like 6 months at a time sometimes, and they're trying to really struggle with that sleep deprivation.
Right. Sleep problem is very common in Parkinson's patients. The most difficult thing is staying asleep. Like they would fall asleep, but they have if suppose if they go to bed around 10 and they fall asleep within 20-30 minutes, then they will be up by 1 o'clock and they have trouble falling asleep. That's called sleep fragmentation. That happens in about 1/3 of the patients with Parkinson's. So it is challenging. One of the reason is because most patients are taking the dose of levodopa in the evening, and by early morning, like 2 o'clock or 3 o'clock, the levodopa wears off. So they don't have any dopamine in their system. They find it difficulty turning in bed. Sometimes they have cramping of toes or feet,
Yeah.
or they have to go to washroom multiple times. And some patients may feel pain. And also some patients have hallucinations or anxiety attacks. So their nighttime become quite a challenge. So what we suggest patients, starting from simple strategies, is exercise in the afternoon. If you exercise aggressively, so then your sleep improves. And also try not to take multiple naps in the day. If you want to take a nap, a noontime nap should not be more than 25 minutes or half an hour or so, right? And I usually advise my patients, yeah, I tell them, if you want to take a nap, don't go into the bedroom, because if you go into the bedroom, you're going to sleep for a couple of hours, right? So just sleep on the couch in the living room. If you sleep for 25 minutes, there'll be some noise, your spouse or someone is walking around and you'll wake up. So a short nap in the daytime, that helps. Exercise helps. Also, there are principles of sleep hygiene. We have brochure number 5, which talks about sleep, like having a fixed sleep schedule, not having any devices in the room, avoiding alcohol, avoiding caffeine, avoiding liquids in the late evening. So these are some basic strategies. Other than this, patients can use melatonin. Melatonin is quite helpful to fall asleep. And if patients are, if they're taking the last dose around 6 or 7 p.m., then one dose of a dopamine agonist or levodopa could be added at bedtime, so that they can have it can last for 4 or 5 hours and they can have a sleep. Other factors which are causing pain, or so, or bladder dysfunction, that need to be addressed as well. Sleeping medications is the last resort. If nothing works, then some patients can use the sleeping medications.
Perfect. Thank you. Thank you very much.
Great, thanks for the question. Dr. Rana, I'm going to blend two of these together again from a caregiver's point of view, trying to understand the normal progression of the disease kind of diagnosis through to end of life. I think this person has experienced maybe a quick progression in their father, and they're kind of shocked because Parkinson's is, and you've even said it, is a slow progressing disease. So what do you say to someone who's looking for kind of a progression arc where they think that they're progressing faster than they should be?
So, Parkinson's is not one disease, it's a group of, diseases. So the broad term is Parkinsonism. Under Parkinsonism, there are some atypical Parkinsonism that progresses very fast, and that includes like progressive supranuclear palsy, multiple system atrophy, corticobasal degeneration. These are lumped under this term Parkinsonism. And in the beginning, it may be really difficult to distinguish from regular Parkinson's, the idiopathic Parkinson disease, or per se, just quote unquote Parkinson's disease. The Parkinson's disease is in about 80% of the patients have the regular Parkinson's disease, and about 20% or so have other causes of Parkinsonism, such as I mentioned, atypical Parkinsonism. So the first step for neurologists is to differentiate whether patient has Parkinsonism, atypical Parkinsonism, or Parkinson's disease. Atypical Parkinsonism progresses faster, much faster, and it does not respond to medications as good as the regular Parkinson's. So that might be case in some patients. So now, if you move to regular Parkinson's, among the regular Parkinson's, there are again various types. If you have Parkinson's with tremor, with shaking, that does much better than the Parkinson's without shaking. Although it seems like in worse, like the shaking is embarrassing, but these patients do much better in the long run than those patients who don't have shaking. And also, the elderly you are, the prognosis is not as good. If you have other conditions like diabetes, heart issues, osteoarthritis, that also affects Parkinson's negatively.
Perfect. The next question is asking a little bit more about the neurology and how the disease may eventually affect someone's brain and neurological function.
Well, usually patients start with slowness of movements, but their cognition in the beginning is reasonably good. They can manage their daily activities. They can carry on their banking if they are working in a job for in the beginning. For some patients, for a few years, they can manage their work. But as the disease progresses, um, the organization of things become a challenge. Initiating new things or planning various activities becomes more and more difficult, and patients have to cut down their work or make it simple, and eventually they may not be able to continue work within a few years. And so it all depends how on age, stage of disease. Every person is different and what type of Parkinson's they have. Eventually, about half of patients, or even more than half, would get difficulty with cognition. So then if they have other non-motor symptoms such as anxiety, depression, it'll be really difficult to continue working for them. So cognition is one of the important area which is affected, and it has to be, it has to be addressed to some extent.
Okay. I'm gonna just ask you one more question then. Does Parkinson's ever affect the involuntary muscles like heart and breathing and like digestive functions?
So Parkinson's is a, it's a movement disorder, although we say that patients have motor symptoms and non-motor symptoms, but what I say, and that there is not a single system in the human body which Parkinson's does not affect. It affects almost every single system of human body. For example, breathing. It may not affect lungs per se, but the complications of Parkinson's. For example, patients with Parkinson's are more prone to having pneumonia. They can inhale their own saliva. They get infections of lung, and they may need hospitalization for that, right? And similarly, the patients with patients with Parkinson's, they have blood pressure fluctuations. As the disease progresses, the blood pressure goes low and low. So when they stand up, their heart rate increases, and their blood pressure drops, and these patients feel dopey. Also, constipation is a very common symptom of Parkinson's, is almost seen in about 90% of patients. So yes, the other organs, including heart or lungs or a function of these organs, is affected in Parkinson's.
Okay. Nadine popped a question in about herbal remedies, but I also then had a question about foods to take or foods to avoid. And do you have anything about kind of these lifestyle changes that people could make, what you're ingesting, what you should avoid for helping mitigate your Parkinson's symptoms?
Yeah, there's no special food for Parkinson's because most patients have constipation. So a well-balanced diet is good, and a lot of fiber, a lot of fluids. So these things do help uh, do help constipation. Sometime in the mornings, a warm liquid can induce the bowel movement. So these are main, main strategies for food. Also, high protein food, for example, with levodopa, you need to have a gap of about 45 minutes to an hour to prevent the delayed absorption of the medications. But otherwise, there is no special food for Parkinson's.
And what about any herbal remedies, Dr. Rana? Does it help to manage Parkinson's?
A lot of patients ask us about the herbal medication because on these, healthy stores, there's so many things on sale, and they say, oh, it can help this, it can help that. So the problem is, the medication like levodopa, it does come from legumes, right? But the medications are highly calculated and purified form of dopamine. But if you take these legumes, you don't know how much dopamine you're ingesting. You can't you monitor it, and sometimes there may be other contents in it. So we don't suggest people using these things and sometimes they may not need levodopa at that stage if their disease is very, very mild, right? So it can cause motor fluctuations and absorption problems. So we should avoid these healthy store products.
Connected with this question, Gloria is asking about legumes with levodopa you mentioned earlier.
Right. Yeah. So these legumes, when taking legumes, you don't know how much levodopa you're taking, how much dopamine in it, right? So it's a highly the dose in Parkinson's is very calculated and very precise, and the neurologists have to look at everything, other medications and stuff. So we don't suggest patients taking legumes. Right?
Except for legumes are very good for you and full of fiber and a nice protein source. So, you don't have to avoid them, but it's not necessarily enough dopamine in there to, change anything now that you've seen a neurologist and are taking actual, prescribed medications. I'm going to kind of open the floor up for one more, if anyone else has any questions. I've got one more here from our submitted questions. If anyone else has anything, we'll move forward. And I think these questions here come from, the hardest decisions that family have to make. And I think they want to hear it from, a medical professional. How do you know when it's time for a long-term care facility? And how do you keep someone comfortable when they're late in their progression? And I think that, this is something that all families will end up struggling with at some point in time. But from your perspective, what are the kind of key things to look for when making those decisions?
There are several factors which can affect the decision that the patients are not safe to live alone or even live with their spouse. For example, if they have significant issues with balance, they're falling multiple times. Sometimes we tell them to have a room on the first floor, and use assistive devices like weighted walkers at all times, right? But as the disease progresses, the living alone or living with someone who is of the same age, and spouse may have their own medical conditions, it may be difficult for them to to provide the physical support to the patient. That is one of the factors. If patients have hallucinations, sometimes patients need extensive care. For example, if they wear pull-ups, they have bowel and bladder dysfunction, right? If their cognition is affected. So these are things which become more challenging as the disease progresses, and patients may not be safe to be at their home, and they need assisted living. So these are main things, but it all different for every patient. If there's a young onset Parkinson's, they can manage Parkinson's for many more years than elderly patients. And also the other comorbidities, if patients have psychiatric conditions, heart issues, if they are on multiple medications, someone need to monitor their medications and someone need to make sure they are safe. So these are main factors.
Great. Hi, Satya. I've got your hand up.
Good morning. I'm so happy to attend this. I don't have a question, but I definitely have a lot of thank you and gratitude to Dr. Rana and you guys for arranging it. As you know, I am involved with a number of senior groups and naturally knowledge is power, for their well-being and everything. And that's why I love to attend and I enjoy the exercise program. Thank you so much, Dr. Rana, with all the gratitude. And I look forward to your next one. Thank you.
You're welcome.
Thank you, Satya. That was lovely. Because I just am echoing those sentiments. We're so happy to have you here. It's lovely to hear you speak and to get your perspective on kind of what's affecting all of our lives, whether it's us with Parkinson's or as a caregiver or as an exercise support person. We're all, trying to ensure everyone's living the best life they possibly can. I don't know if you had any final words for us, Dr. Rana.
As Satya was saying, knowledge is power. So I always say that those who fight Parkinson's with knowledge always find solutions. So there are always strategies which can improve the quality of life of patients. There is no stage where exercise does not help. Even when they are completely bedbound, at that time, the passive exercises are important. So I think getting involved with organizations such as WPP, exercising, learning about the condition, and the most important is staying strong and positive. I tell my patients, don't think that you are sick. You just think that I'm fine, I'm healthy. This is just a minor condition. I got to manage. And the physicians need to encourage their patients. So it's a teamwork, from family members, patients, and the physician, and the organization like WPP.
Lovely, thank you.
I will make a little more comment if you permit me.
Sure.
Go ahead.
Nadeem and Dr. Rana and your team, I just want to share that we had a picnic yesterday in the park with the senior group. There were over 100 seniors and we did exercise in the park. We danced and, of course, lovely food and everything, but, meeting up with the people, sharing, and you can see how some seniors are isolated and everything. So it is a good job to, bring them out, somehow talk them, get them involved. And that is the purpose for all this knowledge. Luckily, thankfully, I don't have this disease yet, and I hope nobody gets it, but it is what it is, right? So that's why I said knowledge is power, that we can share it and get people involved. If I'm happy, when I meet other people, I make them happy. So that goes on. It's like, very contagious. So thank you again from my bottom of my heart. Thank you.
Your positivity is contagious. So lovely to hear.
I would just like to add one thing. When we have a fever or infection, so we take antibiotics, we take Advil, Tylenol, fluids, and within a few days, you start feeling back to normal, right? With Parkinson's, imagine if you have infection like pneumonia, UTI, or fever, and you don't have access to any medications, how would you feel, right? So Parkinson's is a multi-system condition, and patients have to live with this for the rest of their life. Imagine, and we are so lucky that we are in a country where most of the patients can have their medications covered by government or other resources. There are hundreds and thousands of patients, or maybe millions, in countries which they don't have access to medication purely because of financial reasons, because these patients are seniors, they don't have any jobs, there's no system for pension or health coverage, there's no OHIP or ODB in those countries, right? These patients are forced to live with Parkinson's without medication. So how would they feel if they don't have, when levodopa wears off, how patients feel? They feel so bad. They're back to their symptoms slow, so they have to take the next pill. So these patients live in that wearing off for life. So I think one of the way to show gratitude to whatever we get is to help others. So these patients are looking up to us, and it's a very nominal cost. It's not, Parkinson's medications are not the most expensive medications, right? For us here, right? These are not like the drugs for cancer or something which costs hundreds of thousands of dollars. It's a very nominal cost. If you, if you sacrifice one coffee a day, you can support one patient, $40. People even don't, sometimes, like, you go to a restaurant and have a meal and you end up paying $50, two friends, right? And so if we support, if every patient, I always say that every working patient in North America, if they support one patient, I think we can get help for hundreds of thousands of patients with Parkinson's. So please donate. And WPP is really different. It's not like other organizations. I always, appreciate other organizations, but WPP is quite different. We are providing the most needed element in Parkinson's care, that is the medication. So please step forward and at least support one patient.
Dr. Rana, well said. Thank you so much. And I can vouch for it because my father suffered with Parkinson's. And when the Parkinson's medication wears off, it becomes so difficult for a patient to move around. And that's the reason why I attached to WPP in memory of my father. And just like to add one more item here, that all the WPP directors are strictly volunteer basis. No one get compensated for any of their services that they do with WPP. All the advisory board members are volunteer basis. And this is the only organization that keeps its administrative cost very low as compared to many other organizations. WPP does not compete with any other Parkinson's organization, just so that you know, because we actually collaborate with other Parkinson's organizations, because we are the unique organization who has approved from CRA to provide medication. So other Parkinson's organizations also collaborate with WPP to provide medicine to their patients. So this is what the focus is, to provide medication to the patients. And we would encourage everyone, visit our website, share your story, and donate. Satya, you have a question. Please go ahead.
Nadeem, I am part of the South Markham Action Committee, which I get the information how you can apply for certain grants, for the well-being of people. Would you like me to share it with you?
That will be awesome. That will be great help.
I will share it with you if you can apply. I understand this, that of course the need is there, and sometimes, people like us, we may be attending it, but not necessarily when we are on a limited income and all that, we can donate for all these things, right? So I will share my information with you. If you can apply for different ones and you get it, I will pray for it and I can talk on it. Thank you.
Perfect.
Yes,
Thank you so much. And if you like to invite Dr. Rana or us to speak any event, let us know. We would be happy to come out and speak to the people.
Yep.
Thank you very much.
In the chat, I have put the link to our donations page. So if you can copy and paste that if you're interested, or send it to your friends and family that you recommend that, WPP gets their support, let them know. And then I've also put in the chat, my email is at info@pdprogram.org. All of that's on the PD program website. So please contact me if you have any follow-up questions. You think of something later tonight that, oh, I should have asked that, let us know. Dr. Rana would be happy to provide you an answer, and we can get that by email. And then the other couple questions, this is all being recorded, so we're going to do a nice little trimmed up version, and we will have that out to everyone by link and posted on our website shortly. As soon as our little student volunteers can get that technology figured out for me.
Perfect. Well, top of the hour, I want to thank every
Sorry,
participant.
Nadeem,
Thank you very much.
Can you post your email address on it?
Sure,
On the
sure.
chat? Thank
I'm
you.
doing it
I'll
right
do
now.
it.
Yeah.
I'll go ahead, do it. You speak, Nadeem.
So yeah, I just like to thank everyone for their time this morning, and please come out, help us, support organizations. Support is not just with the money, support is also with spreading the message, spreading the information, and help us connect with the Parkinson's patients which you know of in your circle. We would love to connect with every Parkinson's patient, and we would love to provide brochures. There are 22 brochures for each symptoms of Parkinson's. And in fact, Dr. Rana just published 14 additional brochures for Parkinson's, and we are in the midst of printing those ones. So there will be about 34 brochures of Parkinson's for each and every different symptoms of Parkinson's and how to manage those symptoms. So we would love to provide that information. If you contact us, let us know, or connect us with the Parkinson's patient, and we would love to provide that information. So thank you so much. It's 10 a.m., top of the hour. Thank you very much and have a great day.
Thank you everyone for joining and attention.
All right, thanks.